you all are doing well. So the next topic for today's class, which we are going to discuss, is your sciatica. You have heard about it in general also. Some people has a problem. I have a sciatic. I have a sciatica. So that the word sciatica comes from the term sciatic nerve, right? The sciatic nerve. And this problem nowadays, why it is getting more worse, and the number of the patients, the number of the clients have this problem, the sciatica. Because of our long time sitting job, right? The long time sitting job, working on the frontal plane more, putting extra stress, or sometimes you have a tendency that you work and putting extra weight on the one side. Sometimes the men who carries the wallet on their back pocket and sitting with that, it can also lead to the problem sciatica. So sciatica, maybe it can be cause of the other problems too. Maybe the disc prolapse, the disc degeneration. When the disc prolapse, if it is happening on the level of L4, L5, in between, it can cause the sciatica too. So there are n number of reasons that can cause the sciatic nerve compression. So let's talk about the sciatica first. So when we talk about the sciatica, my dear friends, it is the excessive pressure, right? The excessive pressure on your sciatic nerve. Excessive pressure on your sciatic nerve for the longer duration of time, creates extra stress or compression on sciatic nerve. And that leads to the inflammation, compression, and that leads to the sciatica. When the prolonged time pain is radiating from your lower back to your feet, to your toes, then it leads to the sciatica. So excessive pressure on your sciatic nerve for the longer duration of time creates extra stress or compression on sciatic nerve. So it leads to the inflammation, compression, and if the pain, this inflammation is persisting for the long time, for the prolonged time, then this condition we call sciatica. So sometimes the pain is like burning sensation, numbness, right? Tingling, that we can say that the nerve related issues are there. So with this sciatica, basically we have to learn from where the sciatic nerve arises first. So if we talk about the sciatic nerve here, so it arises, the sciatic nerve, so it starts from the L4, lumbar 4, L5, then the sacrum start S1, S2, S3. So the nerve arises from between L4, between L5, between S1, between S2, between S3. This is your S4. So 5 branches, right? The 5 branches of this nerve Then it is passes from the side of the hip bone, where your get more prominent at your pubis. At your pubis, where is your two sits bone. So on the base of the pubis, it becomes more prominent. So it starts from L4 and up to S3. Up to S3. So 5 branches are there. Then at the back of the knee, so the nerve is going, it is more prominent here, divides from here, and from the back of the knee, the nerve divides into the 2 parts. It divides into 2 nerves, and then it connects to the toes. So that's why the pain is radiating. If it is prolonged, it gives you some sciatic nerve symptoms like burning sensation, numbness is there, tingling, and the pain is sharp shooting pain with the burning sensation. So this is the sciatic nerve, how it arises, from where it arises and up to where it goes. Now, if we come to the causes of sciatica, the causes of sciatica pain may be the disc prolapse, disc herniation, long time sitting jobs, carrying wallet, on back pocket. Sometimes it comes during pregnancy also. Obesity or any degenerative disorder of spine. So these are some causes, my dear friends, right? Maybe disc prolapse. If the disc prolapse occurs from here, suppose the disc comes out from here, and it can lead problem to the one side or the both side too. So if the disc is prolapsing at the level of between L4, L5, L5, S1, maybe compression, extra compression on your nerves, and then the pain radiates. Disc herniation also, the fluid can move into the different routes, into the different components from L4, L5, S1, S2, S3. It compresses your sciatic nerve. Long time sitting jobs create extra stress on your sits bone, leads to sciatica. Carrying wallet, again the pressure is more, right? The pressure is more. After that, if there is no exercises, so it's better nowadays to carry the wallet on the front pocket, not on the back pocket, where you can feel more compression on your sciatic nerve. During pregnancy, some woman has not a preparation of the muscles and their skeletal system is getting more deviated. The whole postural changes are there. So the lower back compensate and create the extra stress on your sciatic nerve. Obesity is one of the factors. When the muscles become more weaker, the front part, creating extra stress on the back part, and that can lead to the sciatica also. Or any degenerative disorder of the spine, whether it is spondylitis or spondylosis, right? Whether it is spondylitis, inflammation of your vertebral joints, spinal joints, or the spondylosis, when the shape of the spinal column getting lost and it grows, it learns how to affect your normal spinal curvature. So these are the causes, my dear friends, for the sciatica. The next we come to the symptoms. Symptom, the first common symptom is the radiating pain. Sometimes this radiating pain is on one side, or sometimes it's on the both sides. Sometimes it's on the one side, on the one lower limb. So radiating pain it can be on the one side and on the both side. It depends upon which side sciatic nerve is compressed. If it is on the right side, it radiates from the lower back to the right lower limb. If it is on the both side, it can be radiating from the both side, from the lower back to the lower body. So from the lower back, the pain radiates from the back of the hip to the knees and up to your toes. Pain area in the back, buttocks, hip or lower extremities, from where the pain radiates. Which type of pain the person feels that time? Sometimes it is mild, sometimes it is severe, sometimes it is very sharp. It depends upon how much pressure we are putting or the intensity of the disease. Pain circumstances can occur due to injury. How it occurs? Maybe some injury over there, you have fallen down on your back, right? Something hits on your lower back. So can occur due to injury or while prolonged sitting. Extra pressure on the sciatic nerve can cause this sciatica. Sensory changes also happens. Sometimes you feel numbness in the legs and like pins. Somebody is picking the pins over there on your both over the area of your legs. Needle-like sensation, that somebody is putting needles also. Also common, sometimes burning sensation. Every time you feel the burning sensation from the lower back up to the lower body, and foot numbness or weakness. If the sciatica gets, the severity of the sciatica and the intensity, the days, the duration gets more, the pain persists for the longer duration of time, or the condition persists for the longer duration of time, then maybe the weakness or the foot numbness can occur, my dear friends. So now the people ask like, how to check whether it is the sciatica or not. The one test which we go with, this is called the straight leg raise, the SLR. So in the straight leg raise, you have to lay down on the floor, and as you ask, straight leg raise, SLR. As you ask the student to lift your leg up, so above the 30 degree, the person asks very sharp shooting pain, and it confirms that is sciatica, because when you are laying down, it is creating little bit pressure, tightness comes to the hamstring, create extra pressure. So that straight leg raise, as the person is not able to lift above the 30 degree, it confirms the sciatica. Some sign and symptoms also there, maybe sometime tightness on the hamstring also restrict, but it don't restrict into the 30. You can remove or you can place it over there, you can hold it over there and then release. But in sciatica, as you ask the person to hold, so after 10 and in between the 30, pain is too much. Sharp shooting pain, person is not able to hold the leg for the 10 seconds also. So that confirms that the person is suffering from the sciatic nerve compression. Then you can take the simple test over there. I'm giving you an example. Suppose this is the whole sciatic nerve, which is going up to my feet. So I'm taking this over there, the whole sciatic nerve, and the nerve is going from here, right? The other nerves also goes up to the skull, up to the cervical spine. So as you are sitting from here, if we look at, change the angle. So this is the nerve. It's going from my buttocks, and the whole nerve system is there, but the sciatic up to the lumbar, but the other nerves are passing up to the cervical spine. So as you ask the client, if I'm trying to bend like this way, pain increases more. Sometimes overstretches the other nerve, compression. So you ask the client to flex your toes, bring your head back, down, extend. As you extend, nerve gets stretched. So when you're bending forward, nerve stretch over there. So you can ask to hold it over there. If you hold it, if you ask the person to extend your knees and bend, forward flex your neck, pain comes. This is the sciatic nerve compression. When you ask the person to extend your knee, flex your neck, if the pain is come, by this test also you can confirm that the sciatic nerve compression is there. So it can be effect to the other movements of your neck too. Extension plus flexion of your neck, and you ask the person to extend your neck, it creates stress on the sciatic nerve too. So now the person asks that what kind of poses are good for the sciatica. So why this sciatica happens? As we have discussed in the causes, due to more time sitting jobs, working on the frontal plane more. So we must have to avoid forward fold here. The forward bends we have to avoid. If we are doing, it create extra compression on my sits bone and the sciatic nerve too. This can be get more compressed or more prolapsed. So the good poses which you can do, that we can use the pigeon pose. We can use some gentle extension exercises, the cobra pose which we can use. Right, you can use the hero pose also. Gentle poses, you can do this figure of 4 stretch. You have to bend your right knee, placing on the left knee and stretch this one. And hold it for 5 to 10 seconds, maximum 30 seconds, and then release. Then we can go with the other side too. If you have a sitting job every day, practice the stretch 3 to 5 repetitions, 3 times a day. Then you can do the knee to chest to release the stress from your buttocks. Hold it for 15 to 30 seconds, 3 to 5 repetitions on the both sides. You can do stretching some of your piriformis muscle, because sometimes there is a tightness on your piriformis that leads the compression to your sciatic nerve. So some piriformis stretch you can do also to release the pressure from your piriformis muscle, so it can release the pressure from your sciatic nerve also. Pigeon pose we can use. You can use some stretches on the sideways, so you can release the pressure from your side muscles of the spine, so that release the extra stress around the muscle which is close to your middle part of the spine, so that release the pressure from the sciatic nerve also. So these are some of the poses, guys, that which we can practice with the sciatic nerve, but we have to avoid forward bending, because due to compression, due to working on the forward plane, this problem occurs more. If you want to do the gentle stretch, you can use the forward bend. If you want to go, place comfortably here. So you don't have to move too much compression, just slightly get forward and stretch over there. And no extra pressure on the hips that you're trying to push the hips towards the wall. No, just it's for the support and lengthen of your spinal muscles. So this way, basically the mechanism, how it becomes more worst, what are the tests you can do, what are the steps which we have to follow. Magnesium, the vitamin, the magnesium also you can use, which is good for sciatic nerve to build the strength of the muscle and releasing the pressure from the nerves also. So magnesium which we can use, and you have to avoid the high risk food like the packed food you have to avoid, caffeinated food in which there is a caffeine in the drinks you have to avoid. So this is all, guys, what we have discussed with sciatica and the mechanism which we have to follow. So you have to go with simple, gentle postures, the spinal extension exercises, Gentle twisting you can use from the upper back. So this procedure which we have to follow for the sciatic, we have to stretch our piriformis muscles so that sometime due to the long time sitting, the muscle piriformis get over tight and it creates the pressure on your sciatic nerve. So this is the pattern which we have to follow. We have discussed about the spinal anatomy, causes, symptoms and the preventions. So till then, enjoy your day. Namaste. Have a nice day.